Insurance and Medicare coverage for the penile implant is generally very good. Prior to any operation, we'll reach out to the insurance company to ensure insurance coverage, but generally speaking, the coverage is excellent. There are two types of penile implants that we commonly place in the United States. Inflatable, or what are called three-piece inflatable penile prostheses, and malleable implants. Three-piece inflatable penile prostheses are composed of cylinders that go into the erectile bodies of the penis, one typically on each side. Those cylinders are connected by some tubing to a pump that's placed in the scrotum. That pump is connected by some tubing to a reservoir that goes in the groin area where guys can't feel it. In order to achieve the erection, what guys do is simply squeeze that pump, which they can easily feel through the skin of the scrotum. That moves fluid from the reservoir into the cylinders, causing them to become rigid for the erection to occur. Malleable implants remain the same length and rigidity, although they're bendable. So guys can bend them down for every day, can bend them up for sexual activity. It's important to say that both implants achieve the same goal, and that is an erection that is strong enough and that lasts long enough for sexual activity. Just like men come in all different sizes, so do penile implants. During the penile implant procedure, I measure the internal length of the erectile bodies of the penis to ensure that the correct and always largest possible implant is placed during the operation. The inflatable penile prosthesis is controlled by a pump, which is placed in the scrotum where guys can easily feel it through the skin. When we want to have the erection, we simply feel that pump through the skin and squeeze it several times, causing fluid to fill the cylinders, which become rigid for the erection to occur. The erection's going to last as long as we want, because the only thing that tells it to go away is a release valve, which is part of the pump, that guys squeeze, causing the fluid to go back into the reservoir and the penis to become flaccid again. In the case of a malleable implant, the operation is even easier. The penis is simply bent upwards for the appropriate position for sexual activity, and we can proceed from there. Ejaculation and penile sensation are unchanged after penile implant surgery. And this is a very common question and common concern that guys have. But orgasm is maintained, ejaculation is maintained. I think it's important to say that whatever our function is going into penile implant surgery is the function that we would expect to have afterwards from a sensitivity, from an orgasm, from an ejaculation standpoint. The implant is completely concealed within the body. The opening that we make in the skin to place the implant is about 1 inch or so in size and is hidden under hair that grows back after the procedure. Nobody will ever know that the implant is in place unless you want them to know. The implant is made of a polypropylene or plastic material that is non-toxic and non-allergenic to the tissues. The solution inside the implant is just saline or salt water. Oftentimes guys will ask me, well, what happens if that fluid leaks out of the system? It's completely non-toxic and non-damaging at all because it's the same consistency as the fluid that lives underneath our skin. I think it's important to say out loud, there's no silicone that's part of the penile implant at all. The procedure to implant the device is performed in the operating room and typically takes about a half an hour to 45 minutes. We make about a 1-inch opening in the skin and pass all the components of the device, closing everything up with dissolvable stitches. Many men go home the same day, or at most spend one night in the hospital afterwards. Typically, the recovery after penile implant surgery takes 2 to 4 weeks. It's common at 4 weeks for me to teach men how to operate the implant, and at that point, to proceed with sexual activity. Most commonly, men are ready to use the implant about 1 month after the procedure. In some cases, it can be safe to use the implant 2 weeks afterwards, but most commonly, at 1 month, I teach men how to use the implant at that point. Like any mechanical device, there is a certain mechanical failure rate. And for an inflatable penile prosthesis, we would expect for it to last for about 10 years or so. A malleable penile implant will last forever because there are no moving parts to break. Patient and partner satisfaction rates for the penile implant are greater than 95%. It gives a real natural result for men and for their partners over the long term. Anytime we make an opening in the skin for any procedure, there are risks of bleeding and infection. Fortunately, the risks of both of those are extraordinarily low with the penile implant procedure. Mechanical failure is the idea that at some point the implant may no longer function, and typically for an inflatable penile prosthesis, that will occur no earlier than 10 years or so after the procedure. Implant erosion is the idea of a portion of the implant ending up outside of where it was initially placed. That's something that we monitor for very carefully and is also extraordinarily rare, especially in men who are not diabetic.